Health hazards. 5 harmful prescription drugs. We rely on the pharmaceutical business in a world full of viruses and diseases that our bodies are unable to combat. To help our bodies stay healthy, researchers are continually working around the clock to create new treatments. Pharmaceutical medications generally benefit the body, but what if I told you that there are a small number that have the opposite effect? Unfortunately, you would be naive if you believed that the pharmaceutical industry would ever offer hazardous medicines. You presumably believe that it is impossible for them to do so. One of the most dominant sectors of the global economy is the pharmaceutical sector. They have complete authority over what pharmaceuticals are made available to the public and sold there. Watch the video to learn the top 5 prescription medications that can be harmful to your health. Make sure you subscribe to our channel before we start this video so you won't miss out on all the fantastic life hacks, tips, and tricks from your top friends. Proton pump inhibitors. If you're not familiar with PPIs, they work by preventing the enzyme in the stomach wall from producing acid, hence reducing its production. However, it has been claimed that PPIs can increase the risk of dementia, kidney illness, and even heart attacks. Most ulcers are typically caused by the usage of acid, according to research. Speak with your doctor about potential alternate therapies if you have been prescribed a PPI and experience heartburn frequently. What causes your acid reflux should be the major point of attention. Number 2. Prednisone. This is a quick-acting steroid that aids in limiting the release of chemicals that trigger inflammation. Most usually, if someone has lupus or rheumatoid arthritis, they take this. In fact, it compromises the body by making it more susceptible to diseases by suppressing the immune system, which makes the body attack itself. Insomnia, headaches, mood changes, and lightheadedness are some of the negative effects. Speaking of pharmaceuticals, did you know that some research points to some forms of dementia as potential adverse effects of specific prescription medications? Keep watching to learn what prescription pills they are, so be sure you do. Statins. The main purpose of statins is cholesterol management. It is among the substances that adults use the most frequently. Muscle aches, headaches, sleeplessness, and nausea may occur if used for a brief period of time. Long-term use, however, may have negative effects that are detrimental. CoQ10, an essential enzyme needed by the body for energy and cardiovascular function, has been related to depletion with prolonged use. It may not be possible to totally mend cardiac damage without it. A heart attack can be prevented with its aid. Antidepressants. 10 kids over the age of 12 are using antidepressants, according to the CDC. More concerning is the fact that 60% of those kids had been taking it for at least 2 years. These prescription medications can have no effect on some individuals while destroying or injuring their brains in the process while having an impact on others. Antidepressants like Prozac are well known for raising serotonin levels by inhibiting the substance that depletes it. However, after a few weeks of using the medication, the brain adapts by producing less serotonin. Additionally, 1,800 New Zealanders who were taking antidepressants were included in a study by the University of Liverpool. After stopping taking them, half of the subjects experienced psychological problems according to the study's findings. Opioids. Opioids can help you feel better if you are in a lot of pain. Opioids are frequently prescribed by doctors to their patients for acute pain. However, they may not always be the best treatment option for either acute or chronic pain. The largest worry is that people may develop an addiction to opioids. If this happens, they will start abusing the substance, which can result in serious health problems. Damage to the liver is one of these health problems. Alternative treatments. Try putting down the opioids and going for a specific touch if one of your muscles is giving you chronic discomfort. Finding a specialist like a chiropractor makes more sense than tricking the brain into believing the pain is gone. A chiropractor can assist in manipulating the brain's primary nervous system channel to the brain and spine, which may help ease your pain since, in most situations, the discomfort is brought on by a nervous system interruption. High cholesterol. If you have high cholesterol, you should focus more on what you eat than what medications you are taking. Oats, garlic, and olive oil should all be included in your diet since they can help lower LDL cholesterol and reduce inflammation. They may also raise your healthy HDL cholesterol levels. Acid reflux. Use herbal remedies rather than prescription medications if your acid reflux is severe. Elm lozenges are a good example. You can get them at your neighborhood health food store. They do this by smearing antioxidants in the stomach and throat, which reduce gastrointestinal inflammation. They also assist in preventing any excess acid from damaging the digestive system. You just need to look for them. There are always better options than prescription medications. Now you've reached the end. But here's some information about dementia and Alzheimer's and how certain prescription drugs may affect these symptoms. According to Alzheimer's Disease International, anyone worldwide acquires dementia every 3 seconds, and at this time, there are close to 50 million people suffering from dementia worldwide. A few studies have also indicated that some medications such as benzodiazepines, which are used to treat anxiety and sleep issues, are associated with a higher risk of dementia in patients who use them for extended periods of time, according to a study by Harvard Health Publishing. Benzodiazepines. One study found that using benzodiazepines increased the risk of developing Alzheimer's disease, which was published on September 9, 2014 in the journal BMJ. They discovered that those who took benzodiazepines for 3 to 6 months had a 32% higher incidence of Alzheimer's. Additionally, they discovered that people who had taken benzodiazepines for more than 6 months had an 84% increased risk compared to those who hadn't. According to a subsequent Harvard study, drugs are frequently to blame for mental decline. Drug metabolism in the liver declines with age, and drug removal from the body by the kidneys slow down. As a result, pharmaceuticals have a tendency to build up in the body. The elderly, those in poor health, and those who take multiple prescriptions are particularly at risk. This study lists sedatives, opioids, antihistamines, and antidepressants among its list of drugs. The myth about vaccines. It is absolutely untrue, and this misconception has been completely disproved by several studies. There have been various stories and myths about how immunizations cause dementia. A study conducted by the National Institutes of Health and the United States National Library of Medicine on more than 4,392 eligible participants came to the conclusion that prior exposure to influenza, poliomyelitis, and diphtheria vaccines may help prevent the development of Alzheimer's disease in the future. Therefore, it has been demonstrated that those who receive vaccines have a lower risk of developing Alzheimer's disease later in life rather than dementia as a result of immunizations. This indicates that while memory loss, depression, and exhaustion are among the side effects of some prescription drugs and not necessarily signs of dementia or Alzheimer's disease, these symptoms are nevertheless caused by the drugs themselves. Western medicine prioritizes treating symptoms individually rather than focusing on finding the root of the problem when prescribing medicines. Additionally, the body may develop a dependence on medication. For instance, if you only use medications to treat your pain, you might continue to require them even after the discomfort has subsided. Additionally, nutritional deficiencies are one of the negative effects of many medicinal cures. What are your thoughts on dangerous medications? Let us know in the comments section below. If you enjoyed watching Vital Health TV and learned something from this video, please hit the like button and subscribe to our channel for more videos like this. Thanks for watching.